Senior Assistant Regional Coordinator with Metrolina Healthcare Preparedness Coalition. My background is I spent 16 years as a medic in Charlotte area, got my degree and moved into emergency management. Joined the team and have learned a lot from Sherry and the rest of the team. Lauren, did you want to go ahead and introduce yourself?
Part of my job is to ensure that emergency preparedness efforts are inclusive and accessible for people with disabilities. And so have been working with Sherry in this position for the past year, but have been working in the areas of disability advocacy and health for over 20 years. So the emergency management angle of it is a little new, but the rest of it I've been doing for a long time. Thanks, Casey.
Thanks, Lauren. Sherry, if you want to go ahead and move to the next slide, please. So Unit 4 objective, we're going to describe roles and responsibilities of the FAST members, describe the resource request process, where the resources come from. We'll go over the quick notes 213 and 214 forms. Describe basically how to assess, support, and problem solve for individuals and provide an overview of shelter operations. Next slide, please. So the FAST position descriptions was briefly discussed, I believe, Tuesday. There's a FAST coordinator. They basically coordinate all the different FAST teams and are the leads of FAST teams and the State Emergency Operations Center. The FAST team leads, which are, as it says, the leads for the teams at the shelters, and then the FAST responder members themselves. Next slide, please. So the FAST response team members, they'll be responding to different kinds of shelters, but in effect, they're the liaison between the affected individuals and the shelter staff, as well as with the state emergency or the EOC. Sorry, I tend to use acronyms a lot, so I'm trying not to do that today. Their main goal is to help the residents maintain their health, independence, and safety during a disaster or during their time in the shelter. They'll assess the immediate needs. They'll initiate the support request for equipment or supplies. They'll also ensure that the equipment and supplies make it to the correct individual. This is pretty important that we track who the request is for, gets to that individual and doesn't get lost in the shuffle or get misplaced somewhere. We want to make sure the individuals that need the supplies or the resource get that. Next slide. So some of the expectations are basically you're going to deploy to the work assignment when requested. Again, as was stated Tuesday, FAST members never self-deploy. You will wait for your assignment and then go to that designated shelter, whether it be congregate or non-congregate. It's important to also, when you're deploying, to make sure you stay in contact with either your team lead or the coordinator or whatever your direction is. Make sure that they're able to keep track, not so much as just keep track of you, but just you're safe and you get to the shelter. Once you're at the shelter, you will make contact with the shelter team lead or the FAST member team lead and make sure they understand that you're there. And then you'll assess immediate needs of affected individuals. And then you'll initiate the support request, and we'll go over on how to do that later in this presentation. And then ensure, again, the resources are delivered to the appropriate individual. You may want to make sure when the resource gets to the shelter that it gets to the individual that needs it. You also work directly with the disaster service staffs, shelters, whether it's American Red Cross or the county. A lot of the shelters have county public health involved. So you'll work directly with the staff there. You're part of their team. Next slide. So the team lead has a little bit more responsibility. You'll initiate and maintain communication with the shelter manager and with the shelter coordinator. You're kind of the liaison between the two. Also, you're going to coordinate the information flow between this shelter manager and the coordinator. So again, you're kind of like the liaison between the two to make sure there's a controlled process of communication between the staff, the manager, and the coordinator at the state level. You're going to also the FAST members at the disaster center, make sure that they're checking in. If they have any concerns, questions, you're kind of there as their source for information. You'll lead and organize the meetings or briefings, as they're sometimes called. A lot of times the briefings will start when you first start your shift. Sometimes there's 3 shifts, sometimes there's 2 shifts. How you'll start each shift with a meeting or a briefing, sometimes called, get your assignments, any issues or information that needs to be passed that from either the state or from the shelter manager to the team. The team lead will do that. You also and organize all the paperwork, all those forms I mentioned earlier with the 213s and 214s and resource requests, which are the 213s. You'll make sure to get that paperwork up to the state with the coordinator, as well as if emergency management or the shelter manager needs it. You'll prioritize and track support requests. You'll make sure that, again, that the resource that's requested for certain individuals make it to that individual. And if there's any delay or issues, you're kind of the conduit, again, between the FAST team member that's having to assist the individual and that resource. See the demobilization, which is basically you'll oversee when the FAST team is sent home. You'll make sure all the paperwork's in, make sure all the communication, make sure they understand, communicate, maybe do a quick, basically a debrief, or just make sure if any concerns or anything like that is noted and communicated. And big thing is you'll communicate with the FAST coordinator to make sure they understand and keep up with what's going on at your shelter, as well as with your team lead. So the team lead is very important, got a lot of responsibility. They're important in keeping that communication line strong and stable between the shelter and the coordinator and with the FAST team. Next slide, please. So your duties for the FAST coordinator, they'll be working in the State Emergency Operations Center, which is in Raleigh. Again, sometimes it's referred to as the SEOC. You'll contact each FAST member for deployment notification, give the assignments, your point of contact for that shelter, your contact for your team lead, and note anything, kind of get an idea of how long it'll take you to get to the shelter. So they're very important in making sure across the area they'll have many teams that they're coordinating. They monitor WebEOC, which is basically a virtual emergency operations center that the state uses to communicate throughout all the counties, and they'll monitor the resource tracker and respond to the request. They'll collect and disseminate information to deploying FAST members, and they'll provide support to deployed FAST members. They'll keep in contact with the FAST leads. Again, the FAST leads are the liaison between what's going on in the shelter and with the FAST teams, and then gets it to the coordinators so they can any issues or anything that they need to make sure that the teams are safe and the shelter is good. A FAST coordinator is very important because they have they'll be keeping track of a lot of teams and people. But next slide, please. So this is a picture of what the State Emergency Operations Center North Carolina looks like. Many of the operations centers, emergency operations centers throughout the state have similar setups. Like Sherry mentioned before when she was talking about NIMS, it's pretty standardized. So everyone understands positions and how communication should flow. And this is essentially the hub for this whenever there's a response needed. Next slide, please. So this is an example of what a request will look like in the state WebEOC. You see the colored parts in the middle, that's kind of the priority where it says medium, high, and low. There's different levels of priority as far as what's needed immediately. We'll get a faster response than what's maybe low. Sometimes information is just low. So the initial request is usually started by a county emergency manager. The FAST coordinator may do it, but if you look in the status, I think it's like 2 columns over, that's where they can see if it's been complete, if there's an issue, if it's en route. And then there's always updates and situational awareness in the notes. Again, this is sometimes if maybe a wheelchair, several wheelchairs are having to be delivered, they'll make a note of who's delivering it, maybe a point of contact. So this whole page on the WebEOC is something the coordinators will monitor and use this system to track and just main situational awareness, basically, with what's going on with this resource request during the events and where it's the shelters that it's going to. Next slide. So this is actually what a request form looks like, that either the coordinators or an emergency manager for a county would put in. It's pretty self-explanatory. Basically, you've got an area where they'll put notes in. So if it's going to be, they need a bariatric wheelchair, or maybe they need some earmuffs for someone that has maybe autism that needs to have some quiet time. That notes will be in there, and if something happens where maybe the wheelchair man can't get to them quick enough, or maybe they're delayed due to flooding or something like that, the notes will be in there. It's basically any relevant notes that are going to pertain to the team and the shelter. This is where the FAST coordinator will most likely see any notes and can relay it back to the team lead. Down below where there says resource use, is information that can describe the need at the shelter by whoever's requested. That'll go in, and then the previous slide, that's where that will stay and through its progression of requested, en route, unable to for some reason, or completed. Next slide. So the team deploying disaster service center. The FAST we'll check in with the site manager, whether it's American Red Cross or DSS, whoever's going to be the manager for that shelter. The fast lead will check in, introduce themselves, make sure that they have each other's phone numbers. It's very important to make sure you have a secondary point of contact communication line, other than just face-to-face. Face-to-face is very important, but also just in case you have to make a phone call, make sure you exchange phone numbers. Just get an update from the site manager, anything that they've seen, any issues they've had, maybe any concerns, any safety information that they may need from the shelter. They may give you a quick layout of what the shelter set up, especially in a general population shelter where it's very huge, and it may have multiple different sections set up. And then you also need the health services and mental health services. A lot of times with the big shelters, the county public health or the state public health, more likely the county public health, will have nurses there to do any kind of health services and assessments, as well as mental health. Basically, if your team is also driving separately, make sure you get that information and relay that to the site manager. If you have a list of your team members, if you can give that to the site manager, that will be helpful also in case you're not able to be there or be at the front desk or the front entrance when the team gets there. Make sure that you sign in at the registration. This helps the site manager know who's in the shelter just in case there's an emergency. Trying to make sure I got everything. If the site manager, most of them are becoming familiar with FAST. They're starting to, the concept is starting to get out to the counties. County emergency managers are becoming more and more aware of the FAST teams and what they can do. So sometimes when you check in, when the team lead checks in, they may have to just briefly describe what the function of the FAST team is. Mostly just that you're there to work in conjunction with them. You're not there, or you're just there to work as part of their team to ensure that the shelter and all the residents at the shelter are taken care of. Next slide. So the briefing or the meeting, most likely you'll hear it often called the briefing. A lot of times you'll have these briefings at the beginning and at the end of a shift. Usually they're pretty brief. They're just a quick overview of some information that you'll need to start. They're always given by the fast lead. The fast lead will give you updates on perhaps something they've learned from the shelter manager on situational awareness that you need to be for, any changes that may have happened in the previous shift that need to be addressed during the shift, any new residents that maybe come in that they may want you to talk to, any information that possibly the health and services worker or DSS or the public health nurse may want to pass on and make sure that you have the information on. Identify any tasks or needs. You can also give the process and procedures. Mostly that's just if there's going to be a change. Once you've been, your first briefing will probably be your longest. Subsequent briefings will probably be shorter because once you understand the process and procedures and let change, that's usually going to be just on your initial briefing. You'll get any specific assignments or any kind of coordination that you may have to do during the shelter, any high priority needs. or high priority situations the team lead will cover, and also what your shift length should be and what the operational period, basically, of what your shift is going to be. When the next shift time is, or when the next briefing is, like I said, you'll more than likely do a quick, what we call brief out, just a quick meeting saying anything that maybe you've seen that you want to share with, so that the next team coming in can have that information passed on again. Again, just to make sure that communication is constantly flowing. And if the team lead has to share it with the team manager or the coordinator, this is the time that you can really do it. I mean, you can also, by all means, talk to the team lead at any time, but this is the big briefing where they can kind of gather the information and share it with you as well. Next slide, please. So your main role as a FAST member is to assess, support, and problem solve. Don't be afraid to approach people and just talk to people, even if it seems like they are okay or don't need anything. Still, making yourself known or aware to everybody in the shelter kind of helps keep that chain of situational awareness going, because maybe they get a neighbor that they realize, hey, they could use some help getting out of their cot. Then they have a way to, they know once they talk to you that there is help for that person and they can get that. Offer support. Again, it's a wide variety of kind of support, and Lauren will discuss assessing and offering support techniques later on in this section. But offer support, sometimes you're going to have to be creative. These are not always the ideal circumstances or situations, and so you may have to be kind of creative in your problem solving on how to help each individual, since everyone's unique. And so just talk to the people, find out what their needs are, give support, whether it's just knowing that someone's there that cares is a huge thing, especially in this time, because a lot of them are away from their home in a very, very stressful time. Offer ideas and problem solve if anything comes up that seems to be a little challenging, hand in hand with your site manager, your team lead, the health services, the mental health services. If there's anything that you don't see or can't think of, go to your team lead, and they may be able to reach out to the coordinator, and they may have some ideas. So again, work as a team. Be out there with the shelter and make sure that people see you and approach them, just check in with them and offer support. Next slide, please. Connecting with the affected individuals, usually, not always, it depends on if there's a printer available, but there's sometimes building layout or shelter layout that may tell you where maybe certain, where the feeding area is, where the quiet rooms are, where registration is, where bathrooms are, just kind of that map. And if you need to, if they don't have printing, just take notes. Usually in the briefing, this is where the team that may say, okay, well, if you need bathrooms, there's here, if the showers are here, feeding area will be here, and you may just have to take notes if there's not a map available. Talk with the staff. A lot of times the team lead may already do this, but you can ask the site already identified those that need assistance, and you can approach them and see how they're doing. Speak with affected individuals individually. It's hard in a shelter, especially a congregate shelter, to have that quiet conversation. So if they have some reason that they're embarrassed or don't want to have their neighbor overhearing, see if with the shelter manager, your team lead can have a corner that you can talk to if they need that privacy. But speak with them individually. If need be, maybe they want to have the whole family around, or maybe a mom just wants to have a specific one-on-one with you. Arrange a time with them, or an area, like I said, a corner, if they want to, just kind of a quiet area to speak with you. The big part, and it's shown here, is just talk to people. Talk to, initiate those conversations. You're going to kind of be outgoing and show that you're there to support and help them. Next, please. We're going to go over the checklist real briefly, but this is basically a tool that can provide guidance when conducting assessments. It just basically, I'll give you a list of questions to help guide your assessment, kind of almost keep it consistent so you don't accidentally miss something. Keep in mind, this is not an all-inclusive list. You may encounter something unique when you're doing your assessment. Next slide, please. So this is the 213 that I spoke of earlier. This is a request form. A lot of times, in general, it just be referred to as, do you have your 213 or do you have your request form? So when someone asks you about it, this is what they're talking about. It's a documented request, and this is what's usually used by the emergency manager, or the team lead will be able to and send it up to the coordinator, and this is what the coordinator will use to put information in. Just to clarify that one form should be filled out for one affected individual. So if you have a family that has, say, someone's taking care of their parent and has a child that has functional access needs, the parent that has functional access needs, the elderly or senior parent that has access needs would have a form, and then the child would have a form. You can't combine an entire family on a resource request form. So make it out for each person. Be specific as possible on the request forms. It helps both the person fill in the resource, it helps the coordinator, it helps the team lead, it helps the shelter manager, if you can be as specific to the resource needed as possible. And logistics, whoever's filling it may not speak the same language as someone that is in functional access needs. We all speak a unique language. I know as a paramedic, I spoke EMS language compared to someone that's in a management position. So make sure that you're clear and specific, and it helps with finance and reimbursement at the end of the shelter, end of the situation. You'll give this form to their fast lead, and they'll put the request in for you. I think that's it. It's basically used to track progress and keep current.
And Casey, this is Sherry. Can I just jump in for a quick?
Yes.
So do you want to clarify that this fast resource request form, or ICS 213, is used for each individual request. So you may have one person who needs two different things. And so each of those items would go on a different resource request. So you might have Sam Smith, who needs a wheelchair, and he also needs catheters. So you would put catheters on one and you would put wheelchair on another. And the reason we do this is because you might need to get those two different items from two different places. So that request would go with each of those to each of those locations. You might be able to find the wheelchair on site, but the catheter has to be requested through a medical supply service. So each item or each service that is requested needs to have its own resource request form. Thank you.
Thanks, Sherry. Yeah, it's kind of, it seems like, but like Sherry says, it helps keep track of all the requests and that each one is addressed. So when the fast leads, when completed, will make a clear, prioritized request, determine how to get the resource the quickest, and back and supporting requests submitted to that for that individual. The lead will send it to the FAST coordinator. Will be shared on FAST SharePoint for FAST members. This is so they can track the resource progress. And a hard copy will go to the site manager or whoever's running the center, so they're aware of what has been ordered and who gets the item and or whatever when it gets to the shelter. Next slide, please. So the FAST quick notes are used for each affected individual you speak with. Again, it should be with each form should be for each individual that you speak with. It can document requests using detailed information, track progress, keep current. Try to stay away from any patient information or HIP information. It's just basically to identify the need or resource that is needed. Next slide, please.
Yeah, so can I jump in again?
Yeah.
So and I want to reiterate what Casey was saying about information, putting it on this. We want to just make sure we identify the need. So rather than put down a diagnosis, like this person has this, has this disease or has this infection or this, we need to put down what that person needs for it. So this person needs a CPAP. So rather than putting down this person has sleep apnea, which would be a medical condition which would be covered by HIPAA requirements or personal information requirements, if you put down this person needs a CPAP, and then the plan is to request a CPAP from so-and-so, the outcome, they received the CPAP on this date, it was delivered, and they signed off for it. So making sure we're clear that we're identifying on the quick notes what the needs, the plan, and the outcome is versus any sort of diagnosis. And this will keep us out of the HIPAA field and the personal identifying information field.
Okay, the 214. This is something that you'll be using for yourself. Again, a lot of times you'll just hear it as referred to the 214. It's basically a document to keep track of the tasks that you've completed. It's also, you can write down, as it says on the slide, any challenges you experienced during the shift. It's a form that you don't have to track every single, like when you go to the bathroom or when you take a break, but for each person that you speak with or any problem solving that you've had to do is all tracked activity log. You'll do it for each shift. You'll have an activity that you'll fill out. It's completed every day. It's pretty, you'll have to maybe write on the back. Sometimes there's not enough room if you've got a lot going on. But put in your time your date, what you've done. If you spoke with, don't put names, just more like Sherry said, I spoke with someone that maybe needed a CPAP. This is how it went. This is the challenges we found. It's just useful for not only keeping track of the progress in the shelter, but when debriefing or briefing, the FAST team lead can see any challenges or any lessons learned. Again, you'll give this form to the team lead. Next slide.
So I'm just going to jump in again. I also call this the CYA document because this will help and assist if people ever come back and say, hey, you didn't do this or you did this. And if you've got an activity log of what you did do and who you talked to, this also may be helpful if you need to report back to your home agency and they want to know what you've done. Then you can pass on this, and this will show that you actually were at work that day, you did respond, and that sort of thing for timekeeping back at your home agency.
Yeah, again, don't put any kind of HIPAA or personal health information on this, because like Sherry says, you can always turn it into your employer. So we want to make sure that you don't put any patient identifiers, we call it, or any personal health information for the residents that you're supporting, because if this does go back to your employer, it's just going to be a kind of, I don't want to say a public, we just don't want to go into that HIPAA area at all. And okay, I think that was it. Next slide, please. So here's a basic part of how a request process is done. So you'll identify a resource that maybe needs. You'll check your team lead or with the site manager or the shelter manager or whoever the manager deems as their point of contact to determine if the item is available on site. A lot of times the shelters will have basic things like wheelchairs, crutches, canes. So you'll check to see if it's on site first. If it's not, that's when the request will have to be made on that 213 sheet we talked about earlier. That resource will be request will be put into the WebEOC, and then when it arrives, you'll be notified through the team lead. Yeah, I think. Sorry, I was just reading real quick. Yeah, so basically that's the summary of the flow chart. It goes through the shelter manager or will make contact with the county emergency manager that is in contact with the state WebEOC. They'll put that into the request into the WebEOC. Then resource will be delegated out. The emergency manager will be notified, and it's going to be sent, who's going to be bringing it, and then the FAST member will take the resource to the individual it was requested for. Next slide, please. And that's kind of what the request looks like in the WebEOC. There's an example that it'll need 2 Spanish interpreters. It was put in by who it was put in with, who will be supplying it, and its progression. Here they've got the interpreters are on scene. So once they get to the shelter, you'll be notified, and that way you can take them to the individual that needs that translator. Next slide, please. So this is just a shelter overview. We'll go over some various types of shelters that actually kind of depend on the situation. type of shelters. I think we briefly talked about them Tuesday. The evacuation shelters are usually short time, generally 24 to 48 hours while the storm passes through through an area. In most cases, it won't have cots or blankets, but they may have there. So again, if you're deployed there for some reason and someone requests, say, a cot, make sure you check with your team lead or the shelter manager to see if it's actually there. General population centers, these are usually, I don't want to say common, these are what are usually used during hurricanes. They are for people that do have to evacuate. It usually is open sometimes before, such as when the hurricanes hit or hit landfall. They may open prior to the hurricane impact. A lot of times they'll open after the hurricane has impacted. For anyone that's been displaced from their homes or can't get back to their homes, such as flooding that sometimes occurs. These shelters generally will have cots and blankets and other needs. Across has a whole trailer that they bring with supplies to set up a shelter. There'll be feeding. Again, there'll be health and mental services, public health nurse. The state medical support shelter, specific to individuals that need actual doctor, nurse, medical care. They'll be opened either before or after the storms. They are organized by the state. Currently, patients or individuals will have to be either they'll be directed to the state medical shelter if they're going to need the high-level acute care, such as from a doctor or a nurse. And it's more specialized medical equipment is usually at these state medical support shelters. And then the state shelter. We've got one that we opened Florence, I think it was, Sherry. I can't remember. So many of them, but the state shelter is usually open for out-of-state evacuees as well.
Yeah, and this is Sherry. And
Ah.
Hurricane Florence, we did actually open up some state shelters. I believe we had 5 of them, which was the first time we've opened up state shelters in a very long time. Since Hurricane Florence, we've started to put plans into place to have these larger state shelters available and supported at the state level versus county shelters.
Yeah, that's what I thought we had them for Florence. They're starting to run together for me, unfortunately. They're basically supplied and staffed similar to the general population shelters. They're just usually larger than just the smaller general populations the local county emergency management sets up. Next slide, please. So these are just a brief overview of some of the departments or agencies that may be involved with the shelters. You'll see a variety of them. The County Department of Social Services, State Department of Social Services, Public Health, American Red Cross. American Red Cross is usually for the first 72 hours, but they are very good at working alongside with the locals as well as with the state, as with the general population shelters. Next slide, please.
And this is Sherry again. I just want to also say that in some instances it's just DSS, county DSS. Sometimes it's just American Red Cross that are running shelters, and then sometimes they're a combination of both. Some are managed by Red Cross, but staffed by DSS, and vice versa. So you might have a different collection of folks, different agencies that are part of every shelter.
So the shelter activities, the individuals will arrive to the shelter. They'll stop at a registration desk where registration will take information again to keep track of who's in the shelter, just for accountability, to make sure if anything happens, everybody knows who's in the shelter. They're the ones that may be the initial point of contact for some of the individuals with functional access needs, where the individuals may make a comment to the registration. So registration is a great resource for information. It's just the general information is collected at the registration. Dormitory management, they basically oversee the area for the safety of the shelter residents. A lot of times they're a great point of contact for information as well. They may see something, be able to relay it to the FAST team lead or to one of the FAST members. The feeding area, they usually have it set separate, kind of like a cafeteria or canteen area where snacks and water is available to the shelter residents 24/7. The health and human services is usually, the health services is usually the public health nurse. However, sometimes it may be a cross nurse. Like Sherry said in the previous slide, it may be a combination of individuals that are in the health services section, as well as in the mental health services. It may be DSS or American Cross or another agency that's helping out at the shelter, may be in this service. It's important to the residents to have communication available for information and just on the shelter, maybe on the shelter layout, where the feeding area is, where the health and mental health services are. Next slide, please. I think that's where it kind of, yeah, this is basically how general population and how most shelters are. This is one that the American Red Cross, on how they set up their shelters. You can kind of see in the left-hand corner, you've got a kind of a cafeteria area. So that might be where the snacks are. You've got the registration, which is usually in the front lobby. They'll make sure that there's access for all people. And if they may have in the gym, is a lot of times they'll section areas off. If certain individuals need some privacy, they may put up some privacy screens. You'll have a layout of where the bathrooms are, have a separate section for health and mental services. Try to give them a little bit more privacy when they're having to interview a resident or speak with the resident. Those are the general sections of a population shelter. They may quarter off an area for children to play in. They won't call it a daycare area. They usually call it a child play area. Just so if you want the kids to play together, they may section an area that's safe for the kids to play in. May have a quiet area set aside for people. The restrooms, of course, are identified here as well. So this is just what a general population shelter. Of course, it could change depending on where it's located, if it's in a school or if it's in a recreation center. So the layout may be a little bit different for different shelters. Slide, please. The limitations. So some of our community does require advanced care, and accommodation beyond the scope of the shelter. Some may have need continuous health support, have advanced health conditions that require monitoring or support that they can't manage for themselves. They may have life support, significant support, nursing care. Sometimes a lot of these individuals may need requirements that need to go to a higher level of care. Sometimes these will be identified prior to going to the general population center, and especially with the advanced care, be sent to a medical shelter. Next slide. The mass care support trailers, the ones marked in red is where they're located throughout the state. We actually have one in our area, county. They basically have everything that's generally needed for a general pop or evacuation shelter. They'll have such things as, like I said, the maybe standard wheelchairs, folding wheelchairs, standard canes, walkers, transfer bench. Some of them will have the earmuffs and sleep masks. Some will have the folding shower chairs. They all should have a standard list. I think on the next slide, it actually gives you the, can we go on the next slide, please? Oh, we do have that it can give you as far as what all is in the shelter trailers. And again, just basic needs. When you get to the shelter, these trailers should be there. And if not, that's again where you'll have to make contact with the shelter manager or team lead to find out if, in fact, the trailer is there and if these equipment is available. For the next section, I'm going to turn it over to Lauren, and she will.
Casey, let me just jump in. In your participant guides, you should have the list of what would go into the mass care support trailers. So it's in the participant guide in the notes section, if you're following along with that. The other thing I wanted to mention is in the original FAST training that was 2 days long, way back from California, they spent about 6 hours, 4 to 6 hours talking about shelter, what goes into a general population shelter. What we decided to do was have, if you're going to be a fast responder, that you would take the Red Cross shelter volunteer training, as well as the shelter manager training that they have. Both can be taken online, and one will give you a good idea about the general workings of a shelter, and then the second one about the shelter manager give you a better idea of what the shelter manager is going through and thinking about, and all of the different aspects of running a shelter. So having that as a training should help you understand where you fit in the shelter environment. Thank you.
Thanks, Sherry. I believe we have the next slide, please. Yes. Lauren is going to take over here and discuss the assessments. Lauren?
Okay, thanks so much, Casey. So what we're going to talk about now is kind of probably the nuts and bolts of why you all may be interested in being a fast responder. It's what you're doing to assess and meet the needs of people with access and functional needs in this environment. And so we're gonna get into this in a lot more detail in this section. Vicki yesterday spoke, referenced MacGyver, and so this is when we're doing assessments as a fast responder. This is really our opportunity to fill that MacGyver role and really test problem-solving skills, observation skills, conversation skills. That's what you're really pulling from to complete these assessments. So let's go to the next slide, Sherry. Just as an overview of some of the access needs that you may be seeing in a shelter environment. We're talking about issues with feeding and mobility, areas of the shelter that may not be accessible. There may be barriers to communication. There may be problems with accessing showers and restrooms. And so with all of this, it comes back to what the individual feels like they need, and where they're seeing barriers and problems in that environment and their ability to maintain their independence, and to be safe and self-determined, and all of those things that we talked about under the structure of CMIST. So we're going to talk in this section very sometimes generally about some of these specific needs, but it's really important to keep in mind as we're talking about this, that these are not by any stretch the only needs that people have or that you may see as a fast responder. We've got to keep in mind that this is many of the needs that you may come across are very individual. And just like every person is very different, the needs are very different, and they're not always going to fall nicely into these categories. And so you just need to be, this is where it is just so critical to listen to the individuals that you're working with, and also, just be careful not to make those assumptions, thinking that you may know the best need instead of that individual. So just some things to keep in the back of your head. Go ahead and go to the next slide. So for individuals that may depend on electricity for mobility devices or medical devices, oxygen, things like that, obviously power is a huge issue. And often, the lack of power may be why somebody came to a shelter in the first place, because they lost power in their home and they need power for their devices. And so making sure that individuals have access to that power in the shelter environment is going to be a critical thing to assess and help provide that resource if that becomes a problem. This may be more of a problem in the shelter environment is as more and more people have phones to charge and other electronic devices that they want to keep charged. In many of the shelter environments, there are only so many plugs, and so it's a matter of making sure that power stations are set up and areas are set up so that people can access the power, and that the people that need the power for mobility, for medical equipment, for other reasons related to an access and functional need, that they get priority with some of those power needs. Next slide. Casey mentioned a little bit in the shelter environment that there may be privacy screens put up or different ways that shelters may adapt to the need for additional privacy. In many cases, most shelters don't have any privacy. And so you're in a large dormitory area without that. But for people with access and functional needs, other disabilities, this privacy can be really critical in that environment. And so you may be helping somebody come up with solutions to get some additional privacy, whether that's for health reasons, for personal care, hygiene reasons. It may be that it's for a child who has sensory sensitivities and may need less stimulation in a big shelter environment, especially if there are not separate rooms available in that environment. Okay, next slide. So the feeding area is also a place that you may be finding that you're you're trying to look for solutions for individuals. Most of the time it's in a separate area that, you know, there may be issues in terms of spacing between tables, being able to access the food itself. Maybe it's too high, maybe it requires too much of a reach. So there are areas like that that people may come up in an assessment that need to be addressed, as well as, you know, some dietary needs, allergies, things of that manner that individuals may share with you as a fast responder that is a concern of theirs. Go ahead, next slide. So this is just an example of some of the feeding support items. There are items in that mass care shelter that Casey was talking about, where the list is in your participant guide of some of the items that are in that mass care support trailer. And some of these items are there for this reason, to help support individuals with access and functional needs in some more common areas, such as feeding support items. If somebody has a limited grip or difficulty, you know, with accessing food on one of those very flimsy, you know, styrofoam plates that they may have in a feeding area, there are some items that you can use as a fast responder to provide support in that area and to give them an increased level of independence. A pool noodle or foam can be put over the end of the utensil to make that gripping area bigger and make it easier to grip for somebody who has limited grip strength. It's just one example of some of the things that can be done. But the idea is that you're constantly, as a fast responder, thinking outside of the box. You know, what is the need here, and what are the possible solutions? And then, you know, what resources do I have at my disposal, potentially in the mass care support trailer that may be there, or in the shelter itself. There may be other items there that can provide this support. And obviously, as Casey described, if you need items that are not there, there are state resources and other resources to help with that. Next slide. So one of the difficulties that you may find if you're speaking with somebody who uses a wheelchair or other mobility device, issues like transferring may be a barrier to them and may significant problem in a shelter environment. And so, you know, we're talking about that space between cots to allow for space for a mobility device. So it may be you as a FAST team member may come in and say, or a fast responder, you know, let's move the cot, or let's allow more space here, and work with the shelter manager to allow that that accommodation. It may be that the cot needs to be pushed against a wall to allow for more stability for somebody to do that transfer. You may need different devices that help with the transfer, like a transfer board that can be found in the mass care support trailer. It may be that, you know, that individual needs a cot that's what we call an accessible cot, and we'll show some examples of those in a little bit, but that allows a wider space for that transfer and more stability, because it's a little bit bigger cot than the really narrow ones that you often see in general population shelters. So there are lots of different options when you're faced with that issue in an assessment. Lots of different options for you to look to for support for that individual. Okay, next slide. So some individuals may come into a shelter and require additional assistance. They may be living at home independently, but have somebody that come into their house on a regular basis to provide personal assistance services. And these may be everyday, needs that are basic needs like, potentially medication management or filling out forms or things like that, or feeding, or it may be more significant needs, more personal hygiene or toileting or dressing. More needs may be, somebody may need more significant needs in terms of how often that is done and under what circumstances. And so that's where you as a fast responder may need, if that individual needs help with most or all of their everyday needs, you may end up requesting a personal care assistant as a resource request. It's important to remember that, though, shelter staff can help with some really basic things like filling out forms or something very simple like that, somebody who needs more advanced need, that personal care assistant is important. And it's important, like we mentioned yesterday, that your role as a fast responder is not to provide those personal assistance services. It's to get somebody, it's to provide that resource request so that that individual can have the assistance that they need to maintain their independence in a general population shelter. Okay, next slide. So for communication access, this is really a critical piece. I think we tend to talk a lot about mobility devices and things like that because it's an easy example, but I think it's really important to focus on these communication access resources and things that can be pulled into a general population shelter to ensure those that are deaf or hard of hearing or are have low vision, vision disabilities have the same level of communication access as everybody else in the shelter. So things providing, having the registration process, making sure that the registration staff have sometimes it's a low-tech device, pen and paper, whiteboards, a communication, a picture board, something like that may be more low-tech that helps provide more accessible communication. Sometimes it's higher tech devices, an iPad, an iPhone that has an app that can provide additional access. And sometimes it's a pocket talker that's a voice amplifier to help somebody who is deaf or hard of hearing, or a magnifying glass if somebody needs to be able to see forms that are have really small print. So being aware of some of the communication needs of individuals in that shelter, supporting them in making sure that they feel like they are able to communicate effectively with shelter staff, and that you can communicate effectively with them, and to make sure that all of their needs are being met and that they're very aware of everything that's going on in the shelter, all of the announcements and those kinds of things, all of the flyer, a lot of times there are announcements in shelters, there are flyers that are posted on the walls, and we've got to be paying attention as fast responders to make sure that all of those communications that are happening within the shelter are accessible to everybody who is in the shelter. So that may be a role that you play as a fast responder. Next slide. So we talked about the Show Me Tool a little bit yesterday. We have it in the form of a little booklet, or it is an app. And this is a good way to kind of one of those low tech, depending on the format you use, ways to help with communication, allowing people to point to pictures and giving shelter workers some ideas for how to help with that communication process. this tool really does help making sure that there's not miscommunication and that things are clear to everybody that's in the shelter. And so if that's not something that you've had a chance to look for either on your as an app or don't have access to the flip version of that, that's a good thing just as a fast responder for you to be familiar with. And you may draw from your own experience if you work with individuals who have communication access needs in your day job. You may come to this with a wealth of knowledge of how to improve that access. And so that's why, we look to people that have had some experience because you can really use that experience in this environment. Okay, next slide. So we're going to be talking just in the next couple of slides about just interacting and communicating with people with disabilities, and just some, if this is what you do day to day, then you're probably very comfortable, and a lot of this will be review. But if you're not, this is not something, you haven't been interacting a lot with individuals with disabilities, or maybe just with individuals with a specific disability and not a variety of disabilities. These are just some very general things to keep in mind when interacting with and communicating with individuals with disabilities. There are lots of really good resources online that provide a little bit more in-depth look if there's an area that you're not as familiar with or want to dive deeper. There's definitely a lot of resources, but this just gives us a really brief overview for the sake of this training. One of the things before I get into this that I wanted to highlight is that what we encourage for everybody, but especially fast responders, is being really careful in terms of language that you use when working with, addressing people with disabilities, speaking with shelter managers, shelter staff, that our language is always respectful, and that we emphasize person-first language. So instead of saying somebody who's disabled, you would say person with a disability. So the idea being that the focus is on that person first, not a disability or an impairment or condition that may or may not be visible, but that you're focusing first on the person. So just paying attention to language in all of those interactions. And so, when we're communicating with individuals with intellectual disabilities, we're obviously going to treat all individuals with respect. Sometimes it helps to use plain, more simplified language, concrete terms and ideas, and it may be necessary for you to repeat this or repeat it often, depending on the needs of that individual, but making sure that things are not oversimplified, and that you're implying less intelligent, that an individual is not intelligent or can't understand you. You just have to go about communicating a little bit differently. Next slide. So along the same lines, it may be that you're using gestures. It may be that you need to ask an individual to repeat back instructions to confirm understanding. And then it's also important when you're communicating in this way that you're speaking directly to the person. You can engage family or support staff if assistance is needed or that individual prefers that. But in general, your first interaction is with that individual, not immediately going to a family or support staff to ask questions if that individual can provide that information with some accommodation to your communication. And these tips are, sometimes in terms of using simplified language or repetition. Sometimes that's needed for individuals with other disabilities other than intellectual disabilities. For example, if somebody has a speech disability or has had a stroke and has difficulty forming words and verbalizing how they need to communicate. In those cases, you can use some of these same tips to help that communication, but also being really careful that you're not implying that that person, just because their speech is affected by being able to speak slower or finding the words, that they are less intelligent or not able to answer the questions that you have for them. Next slide. So if you are speaking with somebody who is deafblind, or hard of hearing, there may be varied ways that you need to communicate depending on how they prefer to communicate. And so it really comes down to asking them first what they prefer, and then using what you have at hand, which sometimes at that immediate point in time may just be a pen and paper, what they prefer and what works best for them to communicate. Always speaking in a normal tone of voice and a normal pace, and reducing background noise. You've heard that, obviously, unless they're specifically hard of hearing and specifically ask you to do so, speaking in a really loud tone to an individual who is deaf is not going to help them understand any better. So you just need to ask what's preferred and do the best you can to work within what works best for that individual. They're going to know what works best. And we'll go ahead and go to the next slide. So some individuals who are deaf or hard of hearing or deafblind may use assistive listening devices. Hopefully if that's something that they use on a regular basis, hopefully they have that with them. That may be one of the pieces of equipment that they were able to bring with them. If not, that may be something that you may be helping them obtain. And if somebody speaks with American Sign Language, and they either have someone with them that interprets, or the shelter or you as the fast responder is able to provide that interpreter, then you're obviously talking directly to that individual and not the interpreter. And, if materials are needed in alternative formats, such as registration forms or announcements or anything that is provided in the shelter, then that's one of the things that you may be able to do as a fast responder, is to work to get some of that material in alternative formats if it's not readily available. Okay, next slide. One of the, just some tips for communicating with people with vision loss. You're always going to identify yourself. You want to speak, again, in a normal voice, and let people know when you're moving from place to place, let people know when you're leaving, let people know when you're approaching, giving directions that are very specific, such as less 100 feet, or, it's over at 9 o'clock. And you also want to make sure that you're not grabbing, pushing, or pulling a person to move in a direction that you want them to. You can offer your arm and let them know that's what you're doing. If they choose to take it, then you can provide that assistance. But again, just like with every disability, the issue is to ask first and find out what is best for that individual and how they want to interact with you and how they want to communicate. And I'll just mention a couple more things that aren't in the slides really quickly. It goes along the same with individuals with mobility limitations or mobility disabilities, somebody who uses a wheelchair or walker or other kind of mobility aid. You just want to make sure that you recognize recognize the personal space of that individual includes that mobility aid, and that is in many cases is an extension of that person. And so you don't want to move it or push it or lean on it or take it away or anything else without permission. And so you've just got to think about that when working with individuals with mobility disabilities. If at all possible when communicating, try and communicate at eye level. If somebody's sitting in a wheelchair, pull up a chair and have a seat and have that conversation. So just again, some things to keep in mind there. And there, again, I would encourage you, if this is not something that you're familiar with, to go online and access some of those resources. So next slide. So one of the things that you may encounter or be asked about when you're in a shelter situation is whether service animals are allowed, and what about emotional support animals. So in a shelter situation, service animals fall under the Americans with Disabilities Act. And let's go ahead and go to the next slide. So service animals are allowed in all areas that are accessible to the general public. They must be housebroken and under control. And so you may ask 2 questions related to that service animal. Is the animal required because of a disability, and what task is the animal trained to perform? You may not ask about a person's disability, specific disability, or you cannot require documentation for that service animal. And the only reason that a service animal is not permitted in a public place is if that animal is not housebroken or is not under control. Go ahead, next slide. Then you have, so a service animal is different than an emotional support animal. Service animal is covered under the Americans with Disabilities Act. An emotional support or assistance animal is covered under the Federal Housing Administration guidelines and can provide support in that situation. And so this can get a little tricky in terms of, whether the shelter falls under the ADA or whether it falls under FHA guidelines, and it often has to do with how long the shelter is open and, at what point in the disaster it exists. So if this comes up as a question or a concern, maybe that you need to reference, if this is not something you're familiar with, to get some more guidance on if this comes up in that shelter environment, but just to be aware of those issues. And so next slide. So what we'll do, for the sake of time, we're gonna, Sherry, if it's okay, we can run through these quickly. Is that okay?
Yes, absolutely.
Okay, perfect. So what we're going to do is we're going to put up a slide that gives you some pictures of some potential access issues. And I want you all to, you've been listening for a very long time, and hopefully you haven't zoned us out too much, but want you to be interactive in this part of the last part of this section. So we're going to put up a picture, and I want you to look at that, those pictures, and in the chat box, I want you to observe and identify some of the potential access issues that you see in these pictures. Okay, so let's go to the first slide, or the next slide, Sherry. Did that slide advance, or is it just my computer? There we go.
Yeah. So
okay, perfect. It was just my computer.
Yeah. Do you want me to read some of the chat notes?
I can see it now. Thank you.
Okay.
So some of the things you guys hit the nail on the head. Obviously, not enough space between cots. There's not wheelchair access, narrow aisles, too close, lack of privacy. Aisles are too small. So you're exactly right. Let's go to the next slide. So here's a drawing layout of a shelter environment that would be more accessible to an individual with access and functional needs. There are specific areas for accessible beds and cots. The pathways are wide. They're not cluttered. They're clear paths of travel that most likely in this case are 36 inches, which is what we want to provide accessibility based on the ADA. And so, this drawing provides a better setup for a shelter environment. And it may be that when you get into a shelter situation, you may be asking the shelter manager to adjust a little bit to provide more access if you find that you get there and somebody is not able to get to the sleeping area because they've set things up with very narrow aisles and limited access. Okay, next slide. So it's kind of hard to see in these pictures, but this is a picture of somebody in a shower. So these are shower facilities. So we see that ramp access is clearly a problem. There's not a accessible entry there. And my chat may be delayed. So Sherry, if you see other things that are in the chat.
So no accessible shower stall, no shower chairs, privacy.
Yep. Yes, you guys got all of it. Good observation there. Go ahead and go to the next slide. So a solution may be, one of the many solutions, because obviously there were multiple problems with that shower setup. It was inaccessible in a couple of different ways. But one solution may be to request a ramp that would allow somebody access into that shower area. Obviously, you would need to look at things like shower curtains and other issues as well, but this would be one potential solution that you could request as a fast responder. Okay, next slide. So what about these? Yep, no ramp access, no ground level access. They look pretty, very small. Yep. So, yeah, you guys, these would definitely be problematic. Next slide. So when we're looking at access solutions, this may, obviously, you're going to need to request some, different bathrooms, different shower situations. And this, it's maybe even if you're in a larger facility, it may be that the the shower or restroom facility that is designated for the shelter may not be accessible, but there may be an accessible or workable restroom or shower elsewhere in the facility. So it may be working even if, because sometimes getting these requests to get an accessible bathroom, and you've got somebody in the shelter right there with you who uses a wheelchair, is not able to access the bathroom, and then, but the bathroom is inaccessible, what are you going to do right there? So this is where you may have to get creative. Look for other restroom facilities throughout the shelter building. Work with the shelter manager there. Work with other folks, because sometimes this can be a very immediate situation for somebody to not have access to the restroom in a shelter environment. And we're hoping that that as shelters are identified across the state, and specifically with, you know, Red Cross and DSS shelters and state shelters, that this is addressed ahead of time, that we never have a situation where somebody goes into a shelter environment and does not have an accessible restroom. But it's not to say that that's never going to happen. And so you have, as a fast response responder, need to be aware of that. Go ahead, next slide. And this is very similar. We'll do this this one quickly. It's very similar to the last one in terms of space between cots. But looking at this specifically at the cots themselves, I guess would be more appropriate. You know, would these cots be workable for people with access and functional needs? And so, Sherry, we'll go ahead and go to the next slide. So just for you all to be aware that many of the Red Cross trailers, the mass care trailers, now have cots that provide more accessibility for somebody with a mobility disability, with other healthcare issues that may require a more supported environment, rails on the side or padding or a wider cot or one that's a little bit higher to allow for transfer. So, you know, just so you know, these are some examples of ones that exist in our state and that we have access to. So if that's not something that hopefully the shelter would have a couple of those already on hand, but it may be that you are requesting an accessible cot for somebody who needs that extra support on their sleeping surface. And then we'll do one more. So we're going to compare and contrast these two press conferences. What do you notice about the difference between those two pictures? Yeah, the lighting definitely would make that much more difficult with somebody with low vision to be able to see. Also, no captioning, that's correct. That's great. And then, you know, even though there's a sign language interpreter in both of those pictures, the lighting really does take away from the accessibility and the ability for that communication access to take place, as well as, yes, the background in terms of being able to see the sign language interpreter properly. So we, you know, went through those last slides pretty quickly, but I just wanted to give you all, you know, some examples of some of the things that you might see, some of the resources that are available and solutions that might be available. But again, this comes back to your problem solving and your ability to address the individual needs of people that you encounter in the shelter that you can support. We talked all about this in terms of the physical shelter environment, and I did want to just mention that you know, this, but depending on if, you know, you decide to be a fast responder and when and where you would potentially be deployed, it may be very different if we're still dealing with the COVID situation. So, you know, things like social distancing are not taken into account here, as well as the fact that you may be responding virtually. And so we talked a lot about these solutions in terms of observations and just looking around you and seeing what's available and where the barriers are. But if you're not physically in that environment with the person, then you're going to have to rely a lot more on your conversation skills and your ability to ask the right questions and converse with that person to try and come up with those barriers when you're not there to see them. So it just adds a different level of, you know, complexity or ability to be a better problem solver. And with that, I will turn it over to Sherry.
Thank you, Lauren, and thank you, Casey, for your presentation. We will take a break. It's 10:43 right now. We will come back at 10:50 for the next unit. Thank you.